Hi, welcome to NEWSTART Now. I'm Don McIntosh, and I'm joined today with Dr. Brian Schwartz. Glad you're with us today, Doctor.
Well, thank you very much.
You're a cardiologist, right?
I am.
Which you deal a lot with the heart.
I deal primarily with the heart.
Primarily with the heart. And what we're going to talk about today is, we have about 5 minutes, and we want to talk about what the signs and symptoms are of a heart attack. Maybe this will be useful to someone that's watching today. What are some of the signs and symptoms of a heart attack?
Well, there are symptoms that are considered to be classic for a heart attack, but the heart is also called the great mimicker. It can present in many different ways, which means it may not have any symptoms, which we call a silent MI or a silent heart attack.
Is that a high percentage of people that have something like that?
About 1 out of 5 heart attacks might occur without any symptoms whatsoever. But there are classic symptoms, so we'll focus on those first. And they occur more commonly in younger men, and unfortunately the less common symptoms occur more in the elderly or in women.
Okay.
So the classic symptoms of a heart attack would be a crushing heaviness, not truly a pain, but more of a pressure or a squeeze sensation in the heart. There may be symptoms of sweating, maybe nauseated, just feeling anxious. Symptoms may also radiate upwards into the neck or even into the lower jaw with an ache that could feel almost like a toothache. Could have discomfort into the shoulder or particularly into the left arm, and it may just be a little tingly sensation or a numbness.
Do you ever have something in your back, low back pain, anything else, any other things?
It will almost always occur from your belly button to your lower jaw, and anywhere in between could be a sign of a heart attack.
So let's say you're having one of those symptoms, whatever it is. What should you do next? How do you kind of rule it in or rule it out?
Yeah, well, heart pain will last for at least 3 to 5 minutes. It usually builds into your chest. So it's not going to be just a 3-second sharp jab.
So it's not going to be like shooting pain that just goes away.
Yeah, it's not an electrical pain or sharp jab pain. It's going to be an ache that gradually builds, usually for at least 3 to 5 minutes. And if it lasts beyond 5 to 10 minutes, then it's time to be thinking about getting help. So if you suspect that you've never had this pain, you've been shoveling snow or doing something more vigorous or under a lot of stress, and this discomfort in the middle of the chest just doesn't go away.
Now, unfortunately, when you go to a hospital, or maybe fortunately, they take this usually very seriously, don't they?
It's the national guideline that if someone presents with chest pain, that they be back into the emergency room with an EKG and that they receive aspirin within the first 5 minutes.
Okay, so they get an aspirin within the first 5 minutes. Does that kind of thin the blood or something?
Aspirin is still the very most potent medication that we have to help prevent or to fight off the disease of a heart attack.
So, if you're having one of those signs or symptoms, you really should go get it checked out if it's got a 3 to 5 minute type thing like you're talking about. And there are some things they can do to reverse it if they get there soon enough? Yeah,
as a heart doctor, we like to say that time is muscle. The faster you can get help for a heart attack, the more that we can do to try to save your heart. Even up to the first 6 to 12 hours, we can do some good, but if you can get there within 90 minutes and we can get that artery open back up, we can almost minimize all the damage.
Wow. So you have special medications or something you give, or?
There's 2 major ways of opening up an artery during a heart attack. Either we give a clot-busting medication that dissolves the blood clot that forms in the artery, or we go in and do what's called an angioplasty, where we put a little balloon-type catheter that can open up the artery and break up the clot and restore the blood flow back to the heart.
So those can be done right away if you get there?
Well, when I'm on call, I leave my house, I have to be at the hospital within 30 minutes of someone calling with a heart attack, and we have a team that's ready to respond in a heart cath lab very, very quickly. The time in our hospital is to try to get a heart attack victim from the emergency room to the time that we open up the artery within 45 minutes.
Okay, within 45 minutes. Now, let's say you're not near a hospital. The best thing to do is to do what?
Very first thing to do is to
take an aspirin.
And if you're not near a hospital, you need to try to get to some sort of medical care. One symptom of a heart attack that can occur is just sudden death, just having a fibrillation of the heart and dropping over dead. And so it's important to get close to any type of help where they could have a defibrillator and be able to shock your heart back into rhythm if that were to happen. Okay.
We've been talking with Dr. Brian Schwartz. There's more information on this and other subjects at NEWSTART.com. We're glad you joined us today, and we hope that this will help you get a new start in your life. Thanks for joining us, and thank you for being with us, Doctor.
You're very welcome.